first conversation that I have with a woman who has breast cancer is just to help her feel comfortable and help her start to understand that there's going to be options for reconstruction. There's really two main ways to do it. One is using a woman's own tissue, and the other is using breast implants. So starting first with the using your own tissue option, most commonly we use the tissue from the lower tummy area, so that we call it's called a tram flap, or you'll hear Dieppe flaps or pedicle tram flaps. And really what that means is we're taking the same kind of tissue that would be in a tummy tuck, so everything sort of below the belly button. That tissue is removed and brought up to make the breast, and then that area is closed up in a line. Effectively, it looks very much like a tummy tuck operation, but it's more complicated than that because we're taking the tissue off and hooking it up to blood vessels that are just under the ribs in the chest area. If we go with implant reconstruction, then it's often a two-stage process where the first step is to put something called a tissue expander in, and that can be placed at the same time as the mastectomy. The tissue expander is placed under pectoralis muscle or sometimes on top, more common, that's happening more and more now. We expand the remaining skin, and then later, months later, a woman might come back to have an implant put in at that time. Alternatively, we are increasingly also able to put a breast implant in right at the same time as the mastectomy surgery, and that's called direct-to-implant placement.